alarms and mark your calendars, and let's kickstart our mornings together right here on the Morning Crossfire on 99.3 Nigeria Info and Kofi Bartels. Let's talk. What is health? It's more than the absence of illness. It's the state of complete physical, mental, and social well-being. But let's delve deeper. Health is the heartbeat of life. It's the rhythm that keeps us moving forward. The pulse that echoes our vitality. It's a symphony of balance and harmony, resonating in every aspect of our existence. Health is a silent conductor, orchestrating the dance between the body and mind. It's the energy that propels us towards our dreams and aspirations. It is the foundation upon which we build our futures. So, what is health to you? Join me, Kofi Bartels, this and every Thursday for Health Thursday, 8 a.m. on the Morning Crossfire as we explore important issues affecting your health. Only on 99.3 Nigeria Info.
Live from the heart of Victoria Island, you're listening to your number one station, 99.3 Nigeria Info. Morning Crossfire on 99.3 Nigeria Info.
Lagos, welcome back. The Morning Crossfire continues. A special thanks to Jimmy Disu and Sheriff Quadri for the analysis on Delhi today, part 2, right here on 99.3 Nigeria Info. And now time to talk to you and talk with you. We want to hear from you because on Monday we started a series. Did so on Tuesday as well. Yesterday we took a pause, but I did promise that today we'll continue our agenda setting series for Lagos State today. Why today? Because today is Thursday. On Thursday we talk health on the Morning Crossfire. Now I was torn between talking about the new Chinese virus around and all that, but we feel it's important to conclude this process because we've been getting a lot of information from you, and we feel that this program and this platform, this station, is a mechanism, a platform for feedback to government and to society as a whole, for information to government and society as a whole. We get information from you, and we can act on that information by way of our programs, by way of our interaction with the stakeholders, including government. All right, so it's important. Today, we're discussing 2025, setting the agenda for healthcare in Lagos State. As far as you're concerned, what do you think Lagos needs to do in the area of healthcare this year? What do you think Lagos needs to do in the area of healthcare this year? What are those areas, those aspects of healthcare that require attention in Lagos State? We'd like to hear from you. Especially if you are a user of public health facilities in Lagos State, be it federal or state, even local. If any local government has a health facility, please feel free to call. Our numbers are 0201 277 0993, 0201 277 0993. And of course, we have female line 0201 465 7190, 0201 465 7190. All right, and we'll look at all that you want to say. We'll welcome you. We're actually welcoming your thoughts right now. WhatsApp number 08095 975805 for WhatsApp, 08095 975805 for WhatsApp. You can send a short WhatsApp message. You can also send a voice note of 1 minute or less, or you can call us on WhatsApp with that WhatsApp number 08095 975805. Let's leave Ganduje, Moka, Obi for now, Tinubu for now, and talk about health. As far as Lagos State is concerned, the year 2025, what do you think the focus should be on? What we would like to see in the area of health care? All right, we have a first listener on the line. Good morning.
Good morning, Kofi Bartels.
Welcome. Please speak up. What's your name?
My name is Agane John Sunday from Surulere.
Agane John Sunday, all right. Your contribution, good to hear from you.
Yes, I actually am the first caller this morning, and why I even called, I've been calling all these on this station, but you've not picked my call. This is the first time I'm even opportune to speak with you.
Oh wow, that's good to hear. That's good to hear.
Yes, sir. Oga Kofi, I want to ask you for a favor.
Are you talking about health?
Not really. But
Okay. So what you do is we have a topic. We have people trying to call in to contribute. We have a modus operandi. When I pick your call, it should be about the topic. So if this is something you can send to me on WhatsApp, I'll be very happy to, because we're doing something here.
Okay.
Is it a personal request? Maybe something about your life.
The issue is that I'm just tired of salary work.
So bro, this is a public platform. We've raised the topic and the public is trying to contribute, and then you're calling in to talk about your personal life. I sympathize with you, but it's not proper, So
yes, sir.
Yeah. So can you send me a WhatsApp message? I can give you my advice there.
Okay.
All right.
All right.
Thank you very much. Please let's do things properly. All right. I appreciate your calling, but come on now. 99.3. Good morning.
Good morning, Kofi.
Welcome. Who do we have online?
I'm fine.
Your name?
Happy New Year. I've not spoken to you this year. My name is Ibinabo.
Oh, my brother from River State.
Yes, boss.
Yes, so good morning to you. Happy New Year.
Same to you. Yeah, it's going to be a glorious year for us.
Amen.
Yeah, so let's talk about the health sector in Lagos State. Yeah, I use most times the primary health center and the local government health center. The services are good. I must commend that. But their staff, they are nothing to write home about.
Okay.
In the sense that their manner of talking to patients, their dispositions, you feel so discouraged going back to the hospital. Not because of the services they render, but because of the unseriousness of their staffs and the way they talk to their patients. The last time I was there, truthfully, I just had to get a grip on myself. I was almost slapping the nurse.
Which of the hospitals are you talking about?
That one in the Fakojai.
What's it called?
Fakojai.
What's it called?
It's a Fakojai Health Center.
Okay. All right. Fakojai Health Center.
Like, I was almost slapping the lady. They don't have any manner at all. They don't know how to talk to their patients. That's just the only thing about it. But when it comes to the doctors attending to patients and discharging drugs and all of that, totally they work. But apart from the fact that they have very bad disposition for me, but there still can be improvement. Then we don't really have much of emergency centers in Lagos State.
All right. Okay. When you say emergency centers, how do you mean?
Maybe there's an accident before you get health workers to attend to. Sometimes those guys pass out. That's because we don't have emergency centers around.
Okay. How these emergency centers operate? I mean, you're not talking about hospitals, right? You're talking about
I'm not talking about hospitals. I'm talking about mobile hospitals this time, and especially like first responders. We don't get, you understand what I'm saying now. I'm not talking about the hospital. And most times when we have accident victims and we take them to the hospital, sometimes there are no spaces. The last time I was in Lasuth, I saw a lot of accident victims on the bare floor, nobody to attend to them.
Okay.
So we really need to improve on. We don't need to wait until their families or anybody comes before attend to them. Then later you want to ask, okay, how do you contact their families? But because there's nobody to identify, this is my person, they are left on the bare floor unattended to.
All right. We're writing all this down. Thank you very much. I appreciate you calling in, Ibinabo. Thank you very much. All right, we'll revisit it. 99.3, good morning.
Good morning, sir. My name is Frank.
Frank, where are you listening from?
I'm calling from Lagos State.
Oh, yeah, where? Lekki, good. Please go. Yeah.
I'm working at Lekki, but I stay at post. I want to comment Lagos State government.
Okay.
Last on 31st of last month, that was night of New Year. My wife gave birth, and it's free. The name of the hospital is Golden Cross at Texas.
Yeah.
So I'm commending Lagos State government for their good work.
It was free. Is what you're saying?
Yes, it was free. Yeah.
Why was it free? How come?
Although they say there was a time they are registering for card. They say it's 47,000. for family card. That, for example, I'm sick, they will treat me free, they will treat my wife free, they will treat my family free.
Okay.
So we bought the card. So that is why it's free.
Okay. All right. Thank you very much. You're talking about the
Thank you very much, sir.
state health, I think should be insurance. That was launched recently. All right. Thank you very much. 99.3, good morning. Good morning. Welcome.
Good morning, Kofi.
Welcome.
Yeah, my name is Joe. Happy New Year.
Same to you, Joe. Good to hear from you. Where are you calling from, please?
I'm calling from Bagada, right?
Fantastic.
Yeah, so I'm going to be speaking from the aspect of my profession as an impact and evaluation analyst. I recently carried out a research on healthcare services in Nigeria.
Okay.
And it was discovered that for Lagos most especially, the issue we have or the challenge we have is accessibility and affordability of healthcare services. You know, most especially those that are living in the rural community, they don't have access to this quality healthcare. And that is why most of them opt for alternatives like this herbal medicine and what have you. So the solution, although Lagos State government, they are really trying, most especially using this card, for people to have access to the service. But at the same time, they can still do more to ensure that these quality services these quality healthcare services are available to people at the community level. You know, when it comes to maternity rate, that's maternity rate, and also malaria and what have you. So I feel that government can still do more to ensure that they can make most of these healthcare services available and accessible to the rural community. Thank you.
What's your name again?
So my name is Joe.
All right, and you said a study. What study was that?
So the study was, we're trying to look at what are the issues, healthcare issues that we have in Nigeria.
Okay.
So we focusing on 5 key states, while Lagos also 4 in that state.
What organization did this? Is it personal?
Okay. So it's a personal. Although I did it for an organization, but it's also a personal stuff like.
So you say you are a risk what?
So I'm an impact and evaluation analyst.
Okay. All right. I'll copy your number and then I'll call you later.
No problem.
So we can do some more talking.
Thank you so much.
Yes, you're welcome. You're welcome. Thank you very much. Brilliant. All right. 0201-277-0993. 0201-277-0993. I think everybody who's called so far has said Lagos State has top-notch healthcare. The government of the state is doing very well as far as healthcare is concerned. What would you like to see the state focus on in 2025? 99.3, good morning.
Good morning, Mr. Kofi Bartels.
Welcome. What's your name?
My name is Kende Smart from Aja.
Kende Smart, welcome. Your contribution?
Yeah. My contribution is that there are so many loopholes in the healthcare system, which is not making even the government of the day have enough revenue.
Like, loopholes?
Yes, I was at a healthcare facility at Badore, Aja. So they were collecting cash. She asked them what is the account of the facility they don't have. In such things, they can be manipulated because if there's a way you can make a transfer, it goes straight to the healthcare coffers. But when you take cash, you can either add to it or don't even remit it to the healthcare system. Yes, so I think that you try to block loopholes. You make a transfer, you come with your bank receipt. That way to be verified that you paid through a proper channel and you are remitting a receipt and receiving cash.
Right.
So people can just have 20 people come in a day and say it's 10 and there's no way to trace it. That's my take.
So hold on. And before you go, are you there, bro? Are you there? Yeah.
You
said you went to a state public health facility and then you asked to pay cash.
Yes.
Where was this? Where was this?
I think on...
No. Where? What's the name of the facility?
At Badore on Monday. Badore Primary Health Care.
They collected cash.
Mother and child.
Okay, which account did you pay to?
You say?
Which account did you pay to?
There was no account. That's what I'm saying. We paid cash.
Sorry, cash. Okay, so okay. Yeah, that's true. Sorry,
yes, we paid 5,500 for cash.
All right. Did you pay for other services, or you also enjoy the free healthcare?
There was no free. We did some scan, we did some tests, and we still paid. Yes, right. Everything amounted to close to 11,500 something, 500. So don't forget anything there yet.
All right. Thank you for calling in. Appreciate your time. Interesting. I see Romeo. Where is Romeo calling from? Can I put him on? Okay, is this Romeo? Good morning.
Yeah, good morning.
Where are you listening from?
Ejibo.
All right, your contribution, Romeo.
Yeah. You see, there was this issue, like somebody was talking about emergency first responders. Previously there are some of these vehicles that you meet on some particular highways that has like an ambulance stops and things like that.
Okay.
Most of those things I don't know if they have been scrapped or maybe the locations are not different. But it's normally, let me say, within Apapa to Oshodi, you meet one within Apapa, you meet one within Mautu, and towards Oshodi access again. All those kind of things are also good because at least in case of an emergency, anywhere within those vicinities, it can always be a first responder. Then that is number two. Our roads from some particular areas should be a little bit more okay.
We're talking healthcare. Okay, road has impact on healthcare, right?
Road has impact. Getting somebody to instead of getting somebody to the hospital. Right. But when the roads are not good, how do you do that?
Okay, all right. Thank you so much, Romeo. Thank you so much. Appreciate you calling in. 0201-277-0993. We're streaming live on YouTube. Search for Nigeria Info FM. We're streaming live on Facebook. Search for Nigeria space info space 99.3 because I'd like to read your comments. Young Harry Thelma says, I need a number to call in. Young Harry, how are you? She used to listen to us when I was in Port Harcourt under the name Princessa. I'm exposing her now. And it was a big deal in PH then. 08095, number to call is 0201 277 0993. 0201 277 0993. Right. 99.3, good morning.
Hello.
Good morning. Can you hear me?
Good morning.
Good morning. Who do we have on the line?
Yes. I'm calling from Alimosho.
Your name?
Mercy. I'm calling from Alimosho.
Mercy. Good morning. Good morning, Mercy. What's your contribution? Healthcare in Lagos State.
Yes. I was opportunity to take care of my sister at Lutz some time ago. Okay. So my discovery there is that the healthcare system is not anything to write home about. So my own observation was that the doctors, they are trying. That was Lutz, to be precise. The doctors there, they are trying. But the nurses, no. It's only few of them. So that is what we're talking about. Some don't have passion for their career.
What did the nurses at Lutz do? What did they do?
They have this I don't care attitude. But the doctors, I give it to them. They work day and night. But what I discover is that the government is not taking care of them very well. Even the doctors, some of them, you see them making calls. Maybe their friends in abroad, they will be talking like the one that was taking care of my sister. That one, I was hearing one day, he was telling his friends abroad that, this or that, they have not paid them for some time as at that time. That any moment from that time, he'll be telling us that we should, my wife, my sister should recover fast, that he's happy, that he wants to live. So that they are trying, they are very good. They come in the night to take care of their patients. They even buy food for us. Even there's no money, they will be contributing. Some of them will use their own money.
That's the doctors or the nurses? The doctors or the nurses?
The doctors.
Okay.
The nurses, mostly, they are women. Maybe, if they don't pay them, but the doctors, they are good.
All right.
They are trying.
Thank you very much. All right. If there's a nurse listening who works in Lutz, can you call, to tell me if you agree with what she just said? We're still talking healthcare in Lagos State and taking your thoughts as we set the agenda. What should the agenda be for 2025? We'll be right back. Please stay with us.
More conversation, more talk, more right after this.
Attention all stations, your captain speaking. We announce the takeoff of 2 pension giants. T-minus 20 seconds for a secure future. Begin final checks. Access pensions passengers?
Check.
ARM pensions passengers?
Check.
Access ARM pensions, go!
Introducing Access ARM Pensions. Bespoke retirement solutions to suit your needs. Access ARM Pensions. It's mission time.
Baba Precious, you didn't tell me that your wife has given birth.
Given birth?
Your daughter Precious said you have a Smolly at home.
Oh, you mean 3 Crowns Milk Smolly pack?
Smolly?
Yes, it is the new Smolly with tasty nourishment I bought to show love to my treasure.
Aww.
Introducing 3 Crowns Milk Smolly pack. A tasty nourishment. Buy yours today. 3 Crowns Milk. Healthy moms, happy families.
Stay sharp, fuel up, and be on top of your game. Power Horse is here to boost your energy and conquer the day. Don't miss out on an unstoppable offer for Niger. You can now buy Power Horse 250 ml for just 999 naira. And for those who need a little extra, grab the 355 ml for only 1,299 naira. Don't wait. Head to the nearest store today and fuel up. Power Horse, unstoppable you.
Find amazing treats for everyone this holiday with Showmax. Celebrate like a champion with soccer.
Very well taken.
Find your festive inspo with our masters of style.
That's what I'm here for.
Embark on a fun-filled global adventure.
Here we go.
Share your love moments with family and friends.
My son, the most handsome.
And enjoy some truly royal spoils.
I want the power to control what happens in my life.
Only on Showmax, because everyone deserves a holiday treat.
With my golden penny, I enjoy my first choice, nourishing goodness every morning. Oh, when I love all lunch or dinner, quality we deliver. Crunchy snacks, golden penny, serving happiness, nourishing family. Golden penny, yummy golden penny, delicious golden penny, delicious golden penny.
Enjoy happy moments with your loved ones with our delightful range of nourishing, delicious, and satisfying meals from Golden Penny Foods anytime, any day. Golden Penny, home of good food. Serving happiness, nourishing families. Yum.
99.3 Nigeria Info, your number one station for talk. Let's talk.
What is health? It's more than the absence of illness. It's the state of complete physical, mental, and social well-being. But let's delve deeper. Health is the heartbeat of life. It's the rhythm that keeps us moving forward. The pulse that echoes our vitality. It's a symphony of balance and harmony, resonating in every aspect of our existence. Health is a silent conductor, orchestrating the dance between the body and mind. It's the energy that propels us towards our dreams and aspirations. It is the foundation upon which we build our futures. So, what is health to you? Join me, Kofi Bartels, this and every Thursday for Health Thursday, 8 a.m. on the Morning Crossfire as we explore important issues affecting your health. Only on 99.3 Nigeria Info.
Morning Crossfire on 99.3 Nigeria Info.
That's right, you're tuned to 99.3 Nigeria Info. It's a Health Thursday on the Morning Crossfire 2025, New Year. And we're still wishing ourselves, wishing you out there Happy New Year. But it's time to take stock of the past and to plan for the future. And whereas, authorities and everyone is planning, I'm sure the people out there also have a thing or two to chip in based on their experiences as the end users of government, if you want to call it that. So we're asking you for your thoughts. What do you think, Lagos State should focus on in 2025 as far as health is concerned? We've been trying to set the agenda for Lagos State this week. And of course, health is wealth and health is important. And that's our focus today on Health Thursday. Lagos State and Lagos State only. Please call 0201-277-0993. I think, the contributions can be centered around your experience as a user of the health services of Lagos State. We can center your suggestions around your experience. All right. And whilst we're looking at, we're having a number of listeners calling to say Lagos State is doing very well when it comes to healthcare. For me, it's about getting better, going the extra mile, going one step better. All right. Tweaking what needs to be tweaked, fixing what needs to be fixed, and keep moving forward, not resting on the R's. It's very important. And I think that's the same spirit at the Lagos State Ministry of Health. That's why they keep delivering. 0201-277. I particularly like the Commissioner for Health as a top guy, top man. And he knows his business, his onions, and he's been doing a great job. Yeah. But we need to still look at what can we do better. That's life. What can we do better? 0201-277-0993. And I think Lagos State government appreciate things something like this, because any good government will want to get feedback and to improve. 0201-277-0993. That's a first number, studio line 0201-277-0993. Is female line 0201-277. No, sorry. 0201-465, 7190. Can be a bit confusing at times. 0201-465-7190, and a WhatsApp number 08095 and 975805. WhatsApp number 08095 975805. You can send a short WhatsApp message. You can send a voice note of 1 minute or less, or you can call us on WhatsApp. We're also on Skype. Search on Nigerian 4FM. Looking out for your Skype calls, particularly from our diaspora listeners. On YouTube, we're streaming live. Search on Nigerian 4FM. On Facebook, it's at Nigeria Space Info Space 99.3, or type in your browser, facebook.com/Nigeria Info FM. That being said, Lagos State, like some of you have already said, is doing well. And as we continue our discussions in setting the agenda for Lagos State, last year, January 2024, Lagos State kicked off the year by being ranked the 8th city with the best healthcare system in Africa. This ranking was done by Numbeo, which is a renowned research company. All right, and they specialize in quality of life data. In the list, Numbeo used an elaborate algorithm to arrive at its result, and it ranked Cape Town in South Africa as first, Pretoria as second, that's still in South Africa, Nairobi in Kenya as third, and so on and so forth. All right, so that's that. Now, on Saturday, December 14, 2024, at the groundbreaking of the Lagos Medipac Hospital, that one off Awolowo Road in Ikeja, it is said to be a game-changing healthcare hub for not just Lagos State, but for Africa. Now, what did the governor of Lagos State say? Governor Babajide Sanwo-Olu, disclosed that his administration is currently building the largest pediatric hospital in sub-Saharan Africa, which is the Massey Hospital in Lagos. That's on Lagos Island, the Massey Hospital. You also have the largest mental health facility in Ketu Ejiri. He also talked about various, infrastructure in different parts of Lagos State to meet the needs of the people. And no surprises that Lagos State is doing well in healthcare. All right. Now, on December 14, some weeks ago, the Lagos State government put up a Facebook post giving some details of the Lagos Medipac project. And this is what the government said in that post. Quote, "It will provide world-class clinical care and will reduce medical tourism." All right. Bravo. So that's that. Some of these facilities come, but are these enough? Are there other things that you think should also be the focus? All right, apart from the Medipac, the pediatric hospital, the mental hospital. What else? Don't forget, we're all tuned in, keen into the Themes Plus agenda, which has health. The H is health. How about that? 0201-277-0993. 0201-277-0993. In October last year, there was a meeting that they held, government held, to outline what they call an ambitious health agenda for 2025. And the health ministry described it as a vital step towards fostering collaboration, defining responsibilities, and prioritizing strategic health interventions in the bustling metropolis. Now, Professor Akinbayo, we need you on this program so that the listeners can hear from you directly. So I can ask you, I have a lot of questions for you, and so that the listeners can also talk to you, Lagosians can talk to you. All right? So don't keep quoting, your statements, you made at fora. We want to hear from you directly. Anyway, our listeners this morning have said a lot of things. For instance, the first caller said that Lagos State has good healthcare services, but some of the staff have bad attitude. Now I put some of the staff because I know that it's not all. He said the attitude of staff is what the problem is that needs to be also improved on. Another caller said Lagos needs more emergency response points, all right, and facilities, so that if you have emergencies, you can get a response, especially road accidents and the like. Another caller said his wife gave birth free of charge. He was only asked to buy a card for 47,000 naira or so. And I'm thinking that is he and his wife were a beneficiary of the Lagos State Health scheme, the LSHS, if I'm not mistaken. But if I can see the card, maybe I'll be able to tell. But there's a health insurance scheme in Lagos State called the Lagos State Health scheme. All right, or you see the right LSHS. And that's what the Lagos State government has brought on board to achieve what they call universal health coverage for everyone in Lagos State, irrespective of who you are. All right, irrespective of who you are. I think they're trying to make healthcare affordable to the people of Lagos State, and I think that is fantastic. All right, so if you've not heard of it, you can, it's not just for government workers, or it's for everyone. Get affordable health care. So you can go to the nearest Lagos State government health facility, I think, and ask for to be registered under the Lagos State Health Scheme. And of course, that is it. I also hear that companies can also be registered. You can register a company. Now you can go to the website, because they have a dedicated website for that, which is Lagos State Health Management Agency. So you look for the Lagos State Health Management Agency website, and then you can get the details there. All right, just type www.lash, all right, LASHMA. That stands for Lagos State Health Management Agency, LASHMA, all right, LASHMA. Then regulations. .com.ng, all right, .com.ng, and then you can register for that. There's also a portal.lashmaregulations.com.ng. If you go to the website, you just see it there. I've had a look around, but I think the easiest thing for the teeming population to just go to the hospital, like the gentleman did, and buy the card and register and all that. And we'll hope to get we'll get officials from the agency to come and talk about it here, and just so people can have the information to stay healthy. Because people, I went with my with a family member to a hospital for some tests, and they referred us to another hospital to go and do a particular test to get something that they didn't have in that hospital. And all I could say is healthcare is not for the poor, And I said it this week, because the costs alone. But you see, with this Lagos State Health Scheme, I think we can say the poor can access healthcare. Although 47,000 naira is not exactly cheap for poor people, but hey, I think that is a small price to pay if you want to get the services. All right. So that being said, let's take your thoughts. I mean, yeah, okay, enough of the kudos. Tell me the bad things, the things that are going wrong, that you need to fix. Is everything perfect with healthcare in Lagos State? No. I don't hear the other ones. Let's go back to the phone line, 0201-277-0993. And of course, our female line, 0201-465-7190. Now, we have a message here. This one says, I use the Lagos Island Dental. It's close to my office. And for a few years now, there's been this electronic card that carries my medical records, but it doesn't work in other general hospitals. Okay, Lagos Island Dental. Okay, I believe this is an easy fix for Lagos State. The queues are horrendous. I have to dedicate a whole day for dental checkup. Yemi from Abule. Okay, so you feel that that card that carries your medical records is something that should be replicated across all other general hospitals. That's number one. Number two, you're saying that they should work on seeing how they can reduce the crowds at the dental, Lagos Island Dental Clinic or Hospital. All right, thank you very much.
Hello?
99.3, good morning.
Good morning.
Welcome. Who do you have, please?
My name is Kendrick Squala.
Okay, Kendrick Swala.
Kuala.
Okay, good. Where are you listening from and what's your contribution, Kendrick?
Listening from Ikorodu, and my contribution is on security.
All right, we lost your call there. I don't know what happened to your line, so feel free to call back. We're very glad to hear from you if you can do so. But Amy, thank you very much for your message. The other one here says, I agree with the last caller. Lagos needs a lot more trauma centers. Yeah, that's what I was looking for, to treat trauma emergencies. Public enlightenment on first aid is also lacking. All right, thank you very much. Hello.
Hello, good morning.
Good morning.
My name is Utei.
Okay,
and I'm calling from Shangotedo Ajazi.
Welcome. Please go on.
Yeah, my wife registered for our family in this last month.
Okay.
And what we observed that it favors more the pregnant people, the pregnant women, or delivery and all those kind of stuff. For normal treatment for sick people, they don't normally have most of the drugs. You still go back to the main pharmacies and buy the drug there. You understand? Therefore, consultation is okay. And I feel Lagos State needs to decentralize their health centers. There are too few, so there's always crowd there. Time people who used to go and work and make money and be able to treat themselves, they will spend it all day there, and sometimes they get agitated and begin to talk to the doctors anyhow, which is not good too. The doctors are under stress. So that's my own contribution.
Okay, so you're saying that first of all, the health scheme favors the insurance scheme favors
it's
more.
a good thing. That it favors it, but it can be extended. Make sure the drugs are there.
Okay, so
sometimes the people I'm talking about this modern child. Let me be specific here at Ogombo.
Okay.
And most of the time, the person at the pharmacy is not even on seat. Most of the time, you still have to go back to the general pharmacies to buy your drugs.
Okay. So apart from that, you're saying that the crowds are much. You think because
you need more centers.
Okay.
I'm from Delta State. The one former governor Udua, he was very good. He said he was a doctor and he ensured that the health system was good then, but the subsequent governor that came in couldn't follow because he didn't have that same vision. If they have more health centers, even though it's not about size, but small ones in different communities like this, that will help a lot.
All right. So we look at in each maybe in a ward or in a local government, you can divide it
or
into
CD or whatever.
Yeah, you can divide
because
it
even transportation to those centers are even expensive, and people leave very early in the morning, exposing them to criminals. These days, one chance is everywhere.
All right.
Just to be there.
Thank you very much. I appreciate your time. I'll come back to what he said, but what's the state of the general hospitals across the state? Because at some point I think there was some listener may or some. Well, I think I had an opportunity, a reason to pass by Shomolu. So what's the state of the Shomolu General Hospital? And then are all the parts of Lagos State covered by general hospitals, or do you have to go to another place to access tertiary healthcare? Because the tertiary institution, he's talked about the primary health centers, is important, but the tertiary ones are where you can have the more complicated or more complex, procedures, or if you want a surgery or some sort of, very, very serious ailment that a primary center cannot handle, you go to those ones. So are they available? Do all the parts of that? How are they even divided? So first of all, what's happening with Shomolu? Those of you there, Have they started building the general hospital there, or is still the same way it is? Because that's a project that has stalled and needs to be done. I heard somewhere the people are saying that they don't want to move them to, is it Bagada or where? Because they want to move the place, shut it down and build again. And that may be a sticking point. Government is saying we want to shut the place down and build a new one. And people are saying if you shut it down, it means we don't know when it's going to be completed. So I don't know if that is truly the case and if that issue has been sorted out with the community. 99.3, good morning. What's your call it? Because the Shomol General Hospital isn't as it's not where it's meant to be. It doesn't look like a general hospital. But I know the government wants to build a full-fledged general hospital there. They want to build a big one, But maybe community issues or concerns may be a sticking point. I do not know if that is true. If you know about it, you can tell me. All right. One or two persons have also called before in the past to say that they don't have a general hospital in the area. They have to go travel from I don't know where to where, to access tertiary care. 99.3, good morning.
Good morning, Kofi.
Welcome. Who do we have, please?
My name is Abib, calling you from Aboru.
All right. Go on, Abib.
Yes. I want to talk about the LSHS.
The what?
I'm a beneficiary. LSHS, the Lagos State Scheme.
Okay, the Lagos State Health Scheme. Yes.
Yes, scheme. I'm a beneficiary of that scheme.
All right.
My wife gave birth through CS at Ifakoja General Hospital.
All right.
And the processing was very, very smooth. They attended to us very nicely. Even they even have some numbers on their wall that if the nurses or the doctors do not attend to you well, you have to call the number and complain to them. So the scheme was very, very nice. Even I have renewed the scheme again now.
Okay.
So when I renewed the scheme, so my wife went for antenatal. So the nurses now told me that I have to go and pay another 44,000 naira after I have registered for the scheme, which is 55,000 naira.
Okay.
And I called the LSHS. I went to their Twitter page and report. They asked me to submit my details and every other thing. And they told me that I should not pay any money because all the things they're asking me for, my scheme has covered everything. That I should not pay them any money. And okay, so they now asked me that I should hold on, that they will talk to them and do this and do that. After that, they asked me that I should go there, that everything has been solved, that I should not pay any money to them, and which I did not pay.
Oh.
The scheme is very, very nice.
All right.
And they attend to us very nicely.
So you're saying that you registered for Lagos State Health Scheme, the state health insurance, and your wife was able to give birth to your child through CS?
Yes.
Congratulations. And you didn't pay a dime apart from the registration fee?
I did not pay any dime. And they gave me all the drugs that we needed. I just went out to go and buy one or two drugs that they did not have in the pharmacy. But every other thing, the drip and every other thing that I needed for the surgery was given to me for free. How much
did you pay to register?
I paid 40,000. That was before.
Okay.
But
what year was that? What year was that?
That was in 2003.
2003 or 2013? 23.
2023.
Okay. Then this year you went there to register and it was how much?
55.
55.
Yes.
Okay. All right. Probably subsidy removal and all that. So you said after paying that money to register, the nurses asked you for more money.
Yes, they said I should go and pay to Lagos State account to their. I should go and pay 44,000 naira for registration and antenatal and every other thing.
No,
so now report. Okay. And I report the matter to LSHS. I checked their Twitter and I reported. They said I should send email to them, which I did.
Good.
And they asked me that I should not pay any money. Bravo. That every other thing that the money my 5,000 has covered everything.
Bravo.
I should not pay them any money.
Bravo. Which hospital was this?
That was Ifakoja.
Bravo. Well done. And well done to the Lagos State
Health Management. I really commend them for that. They are really trying. Yeah. And the processing was very, very smooth and nothing. The CS was very smooth.
Fantastic. All right. Thank you very much. This is just evidence that, when the government does something right, they don't need to pay anyone, to go on radio or, go on social media, to say anything or attack anybody or, supporters don't need to do it. The people themselves will be the ones who say government is doing well. This is just evidence, and so it's good to hear. So apart from the tertiary health institutions, the primary health centers, a lot. The previous caller before this one has said we need more to reduce the crowd. You know, I mean, are we going to look at every local government, every ward you have one? Because I know a governor who tried to do something like that in one of the states in the South. I think it was Rotimi Amechi who tried to do something similar in the River. He actually did it, where they built primary health centers. Was it in every ward? But the local government had several per local government, and the state government paid doctors good money to go to the rural areas. As a matter of fact, I think under Amechi at the time, if you're a doctor, you decide to go to a rural area, you get paid more than a doctor who's going to be in the city. They provide accommodation, they built everything brand new, gave you everything you need, all the facilities, the drugs, and all that. So I think it's something for the government to focus on. I don't know if they have the plan to build more primary health centers across the rural areas, wards of Lagos State. So if you have headache, you don't go to general hospital, you stay there. And then pay the doctors to stay in these areas. You pay them more than those in the city as an incentive. As you're building these centers, you provide accommodation, provide water, provide electricity. All right. And I think those days, the guy used to hold a town hall meeting, that's Amechi. I was working in River State, and periodically we'll have town hall meeting in local government, and people say, oh, the doctor has not been coming, They report, and then the government will look into it. Well, it's good for government to have, for instance, if you have such a scheme, sort of a hotline. Have a hotline. Call this number if there's any issue with healthcare in Lagos, with the service. That's if it doesn't exist already. But anyway, let's leave it at that. So we need more primary health centers, like the gentleman said. I'm told we have a total of 27 general hospitals in Lagos State. I don't know how true that is. 19 specialist hospitals and 3 teaching hospitals. But I cross-checked that. The bed count also needs to go up. Because one caller said that, sometimes you have a case where you have an emergency, there's no bed space. So I think that's something that can be worked on. 99.3, good morning.
Good morning, Kofi. This is Kelly calling for Ikorodu.
Welcome, Kelly. Your contribution, please.
Yeah. I want to know the Bakojai Health Center. Is it APC member or I just want to know?
It's not for APC members. It's for everybody. Yeah. So you can go and register for the health Lagos State Health Scheme is what it's called. All right, I just want to quickly read messages before we're out of time. And don't forget, the One Play lottery is on. I'll run the draw after reading the news at 9. So please head to the website www.oneplay.ng. The number 1 and the word play together.ng, or you dial *347 *880 *3 hash. The money must go 25,000 naira to 2 lucky players. So whether you play or not, that money is going. Why don't you play? 500 naira per ticket, you win 25k. Sounds like good business, but of course it's a lottery, so it's the luck of the draw. It must favor you. We do random picking on this side. The more you play or the more tickets you buy, the more your chances of winning. Please play responsibly. Right? Please play responsibly. All right, very important. This one says, can I have the number of that woman that said she's tired of salary of job? I think it's a guy, because I asked him to send me a WhatsApp message. You want him to come work for a company as an insurance marketer. All right. Anyway, I'll look at, if I see his message, I'll send your number to him. Thank you very much. Ms. Andrew from Lekki says the Kate Health Center by Legoshi Palace Lekki also doesn't have an account to pay. No transfer, no card payment, only cash. Or cash payment is allowed. Please, Lagos State should help us for that. Thanks. Okay. That's some good feedback. Ikate Health Center, Legoshi by Legoshi Palace. They collect only cash. Why? Another one here says, thanks to this topic on healthcare in Lagos State, the doctors are insufficient. If possible, the state should employ more doctors. About 100 patients are being attended to by one doctor. Secondly, the cost of test in GHL is unbearable. Which one is GHL? And most times you're given no option. It should be reduced. I have an experience there, Mr. Dafik. GHL? Which one is GHL? Is it GHI? Okay, so the cost of tests, and of course you need more doctors. Very important, so they are not overworked. Ike from Ilasamaja says, sometime in November, my doctor referred me to Isolo General Hospital for an eye clinic for ocular B scan on my left eye. It says, I arrived at the clinic and presented my referral letter. I was told there was no printer to print it out or print out the result. Okay, stay with us. I'll come back after this break. All right, please stay with us.
More news and information coming up. We'll be back in a moment.
Happy New Year from Polaris Bank, the digital bank of the year. We dey thank all our customers for our support and patronage last year. We pray say 2025 go be year wey go fulfill all the dreams wey you and your people get. No waste time. Download Vault from Google Play Store or iOS App Store today. Make you start the year wella.
Who says you can't have it?
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.